Hello everybody, I am Lorena from NTI and I am here with Katherine and her mom. Welcome here. So you came from Chicago to Italy to treat Katherine's CRPS.
Yes.
How was your week?
My week was great. Yeah, it's extremely organized here, which I personally appreciate. We set all this up very, very quickly. So like I didn't know about this a month ago, and now I'm here, almost done with my treatment. So yeah, I think we both really appreciated how organized and well run this place is. So, yeah.
Yes, you did very quickly.
Yes.
How did you find out about Neridronate available in Italy?
Yes, through Google. I was getting very desperate to try and find help for Katherine. She's been in pain for 7 months, and it's really hard as a mother. So
yes, and she is a pediatric patient.
Yeah,
She's
yeah,
just
14
years old, so
That's right.
maybe harder for many doctors to access
Yes,
treatment.
it's very hard to find treatment options for people of my age, just because obviously I'm a pediatric patient, so our options like for treatment for CRPS are limited already. But when you're underage, your options are even more limited. They're very apprehensive to do things on you. So.
Yes. So how did you develop CRPS? What happened?
So 7 months ago, I danced competitively. So I was dancing a lot, and I was working out a lot. I'm a very physically active person. So I started having pain in it one day during that month. I went to a doctor, and they're like, "Oh, it's just inflammation. You'll be fine in 2 weeks." Great. And then I went to another doctor, and then he put me on crutches because he thought that the inner lining of my knee was just inflamed. But that just gave me worse pain, and I started having really bad muscle spasms in my back. And then I went to a rheumatologist, and then I went to a pediatric, then throughout all that, I've been on loads of medications. Then I went to a pediatric orthopedic, and he diagnosed me with CRPS because he was an older doctor, so he could diagnose it because he has seen it a lot in his past. So yeah, that's how I got it. Yeah.
Good. And what did you try before deciding to come here?
So yeah, before coming here, before we knew it was CRPS, we tried fully stopping movement, which now we know is not good for CRPS. So we tried muscle relaxers, we tried gabapentin, steroids.
A variety of NSAID pain relievers.
Yeah, like 4 different NSAIDs. Obviously Tylenol, ibuprofen, all of the things. So yeah, and things just kept getting weirder and weirder. Like my whole leg would like blow up. It started like my whole leg was purple, and then it had like sores on it. So yeah, stuff just kept getting weirder and weirder. So we were very worried about that, honestly. So, and then so that's what we tried before this. And my only other option after this, I was told, was an intensive care program, which is a lot of commitment, especially for a teenager. So yeah.
Good. No, I can imagine that as a mother, all this was quite hard on you. So how was the process to get information and arranging everything? How was it?
It was very smooth, very easy. I sent a message through the website, and Jamie contacted me so quickly, set up our Zoom meeting, and because I'm a little bit of an overachiever, I asked, well, what will you need medical-wise? So he gave me all the information of the things that the doctor would need here. We had our meeting 2 days after I contacted him, and
a couple days later we booked our flights.
Right. No, I started. I got him all the medical paperwork.
I qualified.
We did the blood tests, and it was very easy.
Good.
Yeah.
And how has been the whole week, in your opinion? How? Yes, if you like. Yes.
It's been wonderful. It's been stress-free. I haven't had to worry about how we're getting places, what we're eating, where
You're
we're
just
staying.
worried about your luggages that were missed.
Well, yes, if I give anybody a piece
yes.
of advice, please carry on your luggage.
Carry on,
We-
carry on some of your luggage.
carry on some of your luggage, but
But,
we did okay.
but you did some shopping in Italy,
We did some
so
shopping.
Yes, but yeah, overall very they give you a lot of peace of mind, so like they tell you exactly what you have to do and things like that. And obviously I'm kind of like a control freak, so I like to know that personally. So yeah, it's been really great. Everybody's been very, very encouraging.
Very positive.
Very positive. Lots of people to chit chat with while getting
Yes.
these infusions, because obviously they're long. But yeah.
And your turn.
yes.
Oh yes.
So today is the last day for you,
Yes.
and you are going back home with a lot of information,
Lots of
a
information.
lot of
yes.
suggestions. So try to follow them.
Yes.
And you also are going to start a new adventure next week with your next school,
Yeah.
with your school.
High school.
Yes. So, is there anything that you like to say to other patient, maybe other young patient, maybe, because CRPS can affect also teens and kids.
Yes.
Don't wait. Well, I would say if you have the means, don't wait to come, because the longer you wait using your options in the U.S., like I thought the same way, like why don't I try my options in the U.S., but the longer you have it and the longer you keep doing things that don't work, the worse and worse it gets, and then like you're kind of getting out of the prime window to get this done. So if you have the means, do it as soon as possible. Also, yeah, basically that.
Good.
And
What about Italy?
I would say, Italy is wonderful, but I would just add to that
It's not
I
fake.
can understand being apprehensive, because I was, but I'm so glad we came, and it has been just such a positive experience.
Good. And the best is yet to come.
Yes.
So,
Yeah.
yes. Okay. So, you did quite well during the week. It has been a bit painful because there could be kind of effects of the treatment
Yes.
that will be fading away very soon.
Mhm.
So now just our best wishes for your healing, and we will be looking for your news, your updates,
Yeah.
your videos.
Yes.
Yes,
Videos.
you
Dancing
promised
again.
to send me videos.
Uh-huh.
Yes.
Yes.
Yes. So have a safe flight back,
Thank you.
and
you.
best wishes for your process, for your improvements.
Yeah. Thank you.
Thank you.
Thank you.